Hi, Assalamu alaikum and good morning everyone. Thank you for visiting my channel again. Abdurrahim here with you. So today we are going to practice the normal measurements what we perform in a standard echocardiogram. Mainly about the 2D measurements, how we are going to trace the areas, how we should do that, and also I will tell you that what are the normal measurements we are going to do in a normal transthoracic echocardiogram, what are the standard measurements, and I will also mention that what sort of mistakes we do, common mistakes, and how we should be doing it in a correct way. Mainly I'll show you how to measure the 2D measurements, then volumes, LA volumes, LV volumes, RA area, and these all things. I'll show you a complete echocardiogram in which you will be seeing all these measurements. Okay. If you feel I left anything or you want it more in detail, please let me know. Or if you want any other measurements, please write it in the comments so I will get back to you with that. Okay. So let's come into the echocardiogram and I'll show you or perform with you like how we are going to do it. Okay, so this is an echo study and I'll do all the standard or main calculations and then I'll show you how you are going to do it. Okay, I will also be mentioning what are the pitfalls or what are the important tricks you need to keep in mind once you are measuring it. Okay, so we'll start from the first image. Okay, so this is our first image. Okay, you just freeze it and go back. You see this is the red mark. This is showing that where I am now. So if you go by the books, you should be measuring it at the R wave, which is here. But in echo, you just need to measure when the mitral valve closes. Now your mitral valve is closed, you need to measure it here. Okay. What are the pitfalls in it? Let me get the trackball from here. Okay. So this is usually very easy. You will measure it from here to here, this bright line. You are not going to measure this hazy line. This is sometimes the right ventricular side here, but you just need to get this bright line to here. This is your septum. Okay, and you will measure it in this way because your septum is going this way. So you shouldn't be measuring here or here. Okay, you measure it here to here, and then this is very important part here. Okay, because you are not sure whether you should be measuring it from here or somewhere here. So what happens is that these are the trabeculations, you see, but if you look at the wall, this is the continuity of the wall, so it goes this way. There is a bit of dropout, but this is clearly the wall, clearly going this way. So this is the wall. Okay, so you need to be measuring from here to here. So you go into measure. Okay, interventricular septum diastole, you measure it from here. So you will not measure it this way or not measure it this way. You will just go straight down. Okay, this, and then the next one is left ventricular internal dimension diastole. You take it and go downwards till your posterior wall here. Okay, and then left ventricular posterior wall diastole. Okay, so you take it there. Okay, so that's your measurement of the left ventricle diastolic measurements. By the way, these measurements are called Tycho's method, and we get LV dimension. We also call it LV dimension. So we get left ventricular internal dimension in diastole, and then systole, and then we also get interventricular septum and posterior wall thickness in this view. Okay, although the recommended thing at the moment for LV ejection fraction is the volume method, biplane volumes in 2D and or 3D, or if you don't have the good window to do it and you are using this method, this is called Tycho's method, but this is not the recommended one. Okay, so then you go forward and go at the end of the T wave where your LV is squeezing more. Okay, you need to look at the LV. When it gets short, you need to measure it. Okay, and if you go slightly more forward, you will see it's going back. So it means this is your peak systole. Go there and just measure it from here till here. You see again the wall continuity. This is all the continuity of the wall. Okay, this is the wall and this is the continuity of the wall. So you get this measurement. Your left ventricular internal dimension systole is 3.8 and EF 52. This EF is by dimensions. Okay, so now the next measurement would be the LVOT diameter. So for LVOT diameter, if I run this view, this is the view. Okay, you just freeze it and go into the systole when the aortic valve opens. Keep in mind that this one is your aortic annulus. So just 5 millimeter away from the annulus, this till this here. You just need to be 5 millimeter to 1 centimeter away from your annulus. This is your annulus, okay? So you can measure it around here as well. So this is your LVOT diameter. This is one thing, okay? You need to measure the LVOT diameter when your aortic valve is fully open, and then once you see it fully, even you can measure it here as well, okay? For example, I go here and I measure it from here. It's the same 2.3. Earlier it was 2.3 as well, okay? So this is the LV measurements. Now we will go towards the aortic measurements. So as I told you, for the aortic measurement, I usually take the image where I can see the aorta better. Here you go. So now we are going to look, we will get first the aortic annulus, sinus of Valsalva, and sinotubular junction, okay? By the way, in this patient, we're not seeing very clear sinus of Valsalva. Usually it makes a hump at this point. Let me show you. At this point, you will see a hump here and a hump here. So you will measure that sinus of Valsalva. It's not very clear here, but anyway. So we'll start from aortic annulus, okay? So this is your annulus. By the way, keep in mind that your aortic annulus and your LVOT diameter are mostly the same. There might be 1 or 2 millimeters here and there different, but usually they are same, okay? So then this is your sinus of Valsalva, okay? And then this is your sinotubular junction. Sometimes it makes a hump and it makes very clear that this is your sinotubular junction. You are going to measure these 3 dimensions in peak diastole, okay? At the R wave, when your aortic valve is about to open but still closed. So you will measure these 3 dimensions when your aortic valve is closed, okay? Then I went a little bit above. This is, high left parasternal view, okay? For the ascending aorta, I freeze it. For the ascending aorta, some books say that you should measure it in diastole. Some books say that you should measure it in systole. Ideally, you should measure it wherever you are seeing the bigger size of ascending aorta, okay? So I see the bigger size here. This is in systole, by the way. So I'll go and I'll measure it from here till here. So this is internal dimension, internal to internal, okay? Inner edge to inner edge, okay? You are not going from outer to outer. You are going from inner edge to inner edge. So this is your 3.1, okay? Don't measure it from this way, okay? Don't measure this way. Some people does it this way. No, this is not the way, okay? You need to get the inner edge to inner edge, which is this is your inner edge and this is your inner edge. Again, this is your inner edge to inner edge. So this is the measurement, okay? So this is your ascending aorta done. Now you will go next to the next views where you will get, tricuspid inflow, short axis view. You are going to measure this thing, which is the pulmonary artery forward flow, and then this one. You need to get the pulmonary artery acceleration flow. So you go into pulmonic, get the PV acceleration, and just start where it's starting from. The pulmonic signal is starting from. Just click it there, and then you go here, the peak, okay? So you need to measure it in this way, okay? This is your pulmonary acceleration time, okay? If you have any questions, please feel free to ask, okay? Write it in the comments, so I will follow it there. So these are the different views. I'll just go quickly. This is the 4-chamber, again a 4-chamber. This is 2-chamber. I will show you how to do the volumes at the end, okay? First, I want to show you the other measurements. So this is the aortic valve peak flow velocity. This is easy to measure. This is a bit tricky one, which is your pulmonary artery velocity, not pulmonary artery, I would say LVOT velocity, okay? So where is the baseline? Go to the baseline. I'll take the baseline slightly above, just so I can see the signal better. In GE machines or even in Philips machine, you have to measure it automatically. I'm lucky this is very good signal and it's picking up very well. But if it's, sometimes what happens is that it doesn't pick the start of the signal. It usually picks it from here or picks it from here, okay? No, you need to start it where the signal is starting from. in normal patient it might not make any difference while you are doing it, like maybe the uh, this LVOT VTI comes 17, 15, 16, it doesn't make any difference. But when you are having a patient maybe with aortic stenosis or with mitral regurgitation, where you are looking for aortic valve area or mitral regurgitant volume, then these findings play very important role. So you need to be very precise. If you will increase the time here, your velocity will your VTI will increase. For example, I'll show you now. I'm going to do a VTI now. Sorry, it's okay. For example, I start from here usually, okay, and it goes this way. Look at it, it went from 17 to 18.6 because we increased the time here. So that's why. So always keep in mind that you don't need to do it in this way. You need to start from the point where it's starting from, which is this, okay, and end it with where it is ending, okay, this way. So this is our LVOT measurements, LVOT VTI, okay. So okay, so now LA volume. By the way, some people get the LA dimensions or aortic root dimensions in long axis view. That is not recommended. Nobody does LA measurement in that way. Okay, and it's not recommended. It's always false measurement. So you should not be measuring it there. So you will get the LA volumes biplane in 4 chamber and 2 chamber. Just freeze it. Okay, slowly take it. When your mitral valve is closed. When your mitral valve opens, you see now it opens, just go one frame back to close it again. So this is the time when your LA is filled with the blood. So then you need to wait. This is your almost end diastole just after the T wave, but sometimes it might be slightly delay, like in this patient. You see this is our T wave, but we have a bit of delay and we are measuring it here because if I go out of the measurement, you see this is my mitral valve and it opens up here. So I go back, closes it, and I will measure it here. Okay, that's it. Go into the volume, LA volume, and LA and systolic volume 2 chamber. You go into two. Now there is a trick here. In some patients, you will see a very clear appendage here. Okay, you will see very clear appendage here. You should not be including the appendage. Appendage should be excluded. So you should get the volumes this way. Okay, this area is a part of appendage, so you will leave it. You will not include also the part of pulmonary veins. Okay, sorry. So there you go. This is how you are going to measure. So this will give you the LA volume, and then you will put the height and weight, and it will give you the LA volume index. Okay, biplane volume index. So this is how you are going to measure LA in 2 chamber. And we'll go to the next view, which is this, and now we will do the LA 4 chamber measurement. Okay, we'll just freeze it. Okay, and now you can see this is the appendage here. We can see this is a part of appendage here. So you should not be going this way and this way. This is a part of pulmonary vein. Okay, so you should go just straight this way. I'll do it now for you. For example, LA and systolic volume. So you are doing end systolic volume. Okay, you do this. So this is the right way to do it. So this is also pulmonary vein. I'll show you in a while. So this one, let me just freeze it. Okay, this is also pulmonary vein. I'm not including it. This is also a part of pulmonary veins. We are not including it. This is a part of appendage. We are not including it. Okay, and by the cycle wise, you will get it the same way where how you get it in the 2 chamber, that you will let the image move. Okay, and then just freeze it and go slowly. When your mitral valve opens, you see your mitral valve open, go back, close it, and this is the time when your LA is filled. So you should measure the LA in this view. Okay, so next, now this is very important, the LA mitral valve measurements. Now look at this. Luckily we get this sort of patient. So look at the mitral valve opening. If your valve is opening in this direction, okay, the flow is going to this way. Okay, the flow is not going directly this. So if I'll put my Doppler from here, let me tell you, if I put my Doppler from here, it's gonna come this way. Okay, but what's happening, the flow is going to this direction, so my Doppler should be coming this way. So what I should do is I should move this image slightly this way and bring the image here, so my Doppler will be coming this way. Okay, you get my point? Now I'll show you if I change the, hopefully I did it. Okay, get the next view. Okay, I'm showing it again that the mitral valve is opening this way. This will not make any difference in normal patients, but you know, when you are having mitral stenosis or these type of issues where you need, or maybe a prosthetic mitral valve, and you need to measure the gradients, then it will play very important role that your Doppler should be aligned with the flow. So if you will make your habit to do the things correctly, you will never do mistakes. Okay, so look at this now. Okay, I move my image this way. Okay, so let me just show you. Yeah, I move my image, so my Doppler is now coming this way. Not, I would say not 100%. I would still want to be here, but anyway, where I am, I get it. Okay, so this is the one I get. Let me show you where I did it. So it's not showing up the cursor here. So I should move the cursor here and put the Doppler here. Okay, now I'm quite much of a line if I put the Doppler here. Okay, and you should be putting the Doppler at the tips of mitral valve when they are open. Like I will show you when the mitral valve are open, like here. Yeah, so the cursor should be here. When the mitral valve is open, your cursor should be here. You see, the mitral valve is now closed, but when it will open, my cursor will be in between the leaflets. So this is how you are going to put the Doppler in mitral valve. Okay. So how you will measure, this is an easy measurement. Okay, you will just get the peak E wave, just go along with the flow and then do the A wave. So this is your E and A ratio, deceleration time, all the measurements you need. Okay, so then we'll move forward to the next measurements. For the Doppler measurements, you always need to keep in mind that your Doppler should be very much aligned with the flow. I'll make a video on the Doppler as well in next few days, just to make sure like what are the important parameters we need to keep in mind while we are doing the Doppler. Okay, now we came on the right side, so we need to measure the RA area and also the RV. So for the RA area, you will use the same trick where you are going to measure it. Just wait for the tricuspid valve open. Now it's opening. Go slightly backwards when it's closed. So now this is the time when you should measure. Go into the measurement. Go into the area, whatever in your machine. We have RA area. So, okay, so you go here and just trace this area. Okay, so this is it. This is your area. R area. You will start from the annulus and you will end at the annulus. Okay, so you will leave this area. So this is your area, and the area index is 9.5. If your area is more than 11 in index centimeter square, it means your RA is dilated. If it's less than 11 in index, then it's not dilated. Okay, and how you are going to measure the RV? Go back and see when you're usually the book says at R wave, but you just need to wait when your tricuspid valve closes. Okay, this way, just before the contraction. As soon as it closes, you should measure it here. That's the peak time of the RV. So you will measure it at 2 points. We only do 2 measurements: RV basal and RV mid. But if you are doing more measurements, you can just get one more measurement by this way as well. Okay. This is your, RV longitudinal measurement. Okay. Okay. So this is the Tapsi. How you are going to do the Tapsi? You put your M mode on the tricuspid annulus. Okay, and get this one M mode. M mode you will get it, and then you go and measure the Tapsi. This is your Tapsi. So you will start it at after the R wave. Okay. And you just follow the peak here. That's it. That's your Tapsi. The same thing you will do it for the MAPC as well. If you are doing the MAPC, some people don't do it, but if you want to do it, put the cursor there and just measure it. Okay, that's it. And then the tissue Doppler velocities, you put your cursor at the annulus of tricuspid valve and you will get this, you will get the R wave. This one, I think you know about these measurements. And then for the septal E prime and S prime, you just put the cursor on the septal annulus and just measure these velocities. They are easy to measure. You can just go ahead and then you do the same at the lateral wall. Okay. Now we came into the IVC. So recording of IVC is a very important thing. So when you are recording the IVC, you should not follow your normal pattern. Like for example, your machine is recording 1 beat or 2 beats. No, for the IVC, you need to have at least 4 or 5 beats just to show the people, like whoever is reading, or to yourself, make sure like IVC is collapsing properly. If you look at this view, you see, we see the IVC in full diameter and then we see that it's fusing properly, okay, with the inspiration. So once you will measure it, you just freeze it, and wherever you get the bigger area, you just go and measure it, okay. For example, from here to here, okay, I'm measuring it in September. This is how you are going to measure the IVC. Some people put the M mode in this view as well, just to see. So this is how it looks like with the M mode, okay, like this, and you can increase the sweep speed. Because I didn't put the M mode, so if you want to put the M mode, it will be like this. You will see the full and then you will see the closing of the IVC, okay. So that's it. Then you move on to the next image, abdominal aorta. You get the abdominal aorta. This is your abdominal aorta going. You just measure it wherever you see the bigger size of the abdominal aorta, okay. This way, this, and this. You should measure it here. That's it. Your abdominal aorta is done. Then you go to your next view. Oh, I didn't get it very good view, by the way. So this is your supra-sternal view. I think in the video even it looks worse than whatever is in the machine. But anyway, you just freeze it, okay, and see wherever you are seeing the better. I think it looks better here. So you just go and get your arch and descending aorta. You are just going to measure after the subclavian. I think this is the subclavian going on, so you will measure it after the subclavian. So these are the main measurements of a normal echocardiogram. There are some measurements which we need to do for the, like for example, for MR, for AF, and these I will show you when we will be doing those cases, okay. One thing I left before, I told you that I will tell you about the LV volumes later on. So let me do the LV volumes for you, and I will also explain the tricks about the LV volumes. So let's go into this one. So usually when you are going to do the LV volume, I would suggest like increase your gain slightly just to see it better, okay. Freeze it, go to the end diastole where your LV is fully open, okay. This one, you should exclude the trabeculation. These are the trabeculations, okay. Just exclude them. Go into the volume, okay, biplane volumes, 4-chamber diastolic volume, and you go from here, okay. You should not go this way, okay. You should exclude them and you should just go straight to your. So that's your diastole, okay. Now you do the same in your systole. You go at the end of the T wave just before the opening of the mitral valve, okay, and you trace this one as well, okay. So that's it. You get your LV 4-chamber diastole and systole, and you get an LVEF of 61% in 4-chamber view, okay. Now we'll go to the 2-chamber view, which is this one, okay. Freeze it, go at the end here, okay. Now these are the trabeculations, you know, in the 4-chamber as well, okay. So you should not go like this way. No, not this way. You should go straight this way and follow. Where you are not sure about the endocardium, you just follow the next endocardium. Okay, for example, this one, I wasn't sure here, but I follow this endocardium. Okay, and I went this way. So this is one thing. Now you move forward to go into the systole. So just before the opening of mitral valve, there you go. Again, you will not go this way. Okay, these are all trabeculations. So you need to go this way, not this way. You will go straight this way, and you are going to this direction. Okay, there you go. Everything is done. So this is your LVEF biplane is 56%. Okay, this is how you are going to do it. So these are all the important measurements. I think the video has gone too long, so I'll just take your leave. So please ask the others to follow, and if you have any questions, feel free to ask. Thank you. Bye bye.